Hello, I'm Crystal Tully. I am so honored and so humbled to speak with you today. I am excited to share a little bit of my family's story and hopefully just a little bit of the insight that I've gained by being on the other side of a patient's bed, both as an advocate and as a mom. And I guess I'll just start by telling you a little bit about myself. I have been married to Stephen Tully for 19 wonderful years. We met in Monterey, California while we were serving in the U.S. Air Force, and we moved to Augusta, Georgia in 2004. We have two beautiful daughters. Rachel is 15. She is a sophomore at Lakeside High School and an international baccalaureate student. And Anna Grace just turned 18. She is a freshman at Toccoa Falls College in North Georgia, and she's studying counseling psych with a double major in theology. We are incredibly proud of our girls. We are proud of their accomplishments. We are proud of their spirits. And we're just proud of the way that they've taken the story that's unfolded, especially over the last 3 years of our lives, and they've used it. They've used it in a mighty way to help them grow and to help them become more emotionally intelligent and strong young women. And so I just want to share a little bit about that story with you so that you understand kind of where I'm coming from. And hopefully I can also share along the way what I believe have been the high points in the different points of care that we have come across. So I guess I'll start kind of at the beginning. Anna Grace was born in 2003. She was a twin. Unfortunately, her twin did not survive, but Anna Grace did. And she came into the world quite quickly. We were actually in a motor vehicle accident, and she was born in an emergency situation. It wasn't as planned, but she was safe and she was healthy, and that was really all we could ask for. She had a short NICU stay and then was released to come home. And she wasn't necessarily thriving. She struggled. She had multiple UTIs in her first year of life. She struggled to eat, but nothing that was too terribly concerning. We did live in 3 states before she was 1 year old, so there wasn't a ton of continuity of care. I think looking back, had there been, there are some things we probably would have caught earlier on. We did move to Augusta in 2004, and Anna Grace was fairly healthy. We welcomed another daughter into the world. We just kind of pressed on. And Anna Grace had some pretty extensive food allergies in the middle years of her childhood. She also, in 2010, had a scare with some lymph nodes, but that biopsy came back clean, and we kind of moved on. She was thriving. She was in high school in 2018. She was a straight A student. She was an international baccalaureate student, and she was an athlete. Anna Grace was just kind of living her best life. And in February of 2018, as a family, we went to church, to our place of worship, and I like to say that that was a predictable Sunday. I find myself using that word a lot when I describe that day because, quite honestly, in many ways, it was the last predictable day that we had as a family. We went to church, we sat in our normal pew, and we worshiped. And Anna Grace excused herself to use the restroom. And that was a little unusual for her, but I didn't think anything of it. After she had been gone for a few moments, I was really concerned. And so my mama gut just said, go and check on her. And I went into the bathroom, and Anna Grace was washing her hands. And I asked her some questions, and she explained that she had a stomach ache. So I sat down on a bench with her, and I asked her all the normal mommy questions about tummy aches. And I just couldn't quite put my finger on what maybe was going on, but Anna Grace did not seem herself. All I knew is something was off, and it concerned me enough to actually leave her seated on that bench and take about 25 steps outside that bathroom to get a physician who attends our church. And when the physician and I returned to the bathroom, actually, we weren't even able to open the door because Anna Grace had fallen off of the bench and her body was convulsing and blocking part of the bathroom door. So after some maneuvering, we were able to get in and get her in a stabilized position, and the physician took care of her while I went and got help. EMTs arrived, and she actually ended up convulsing again while they were there. And so we did decide to transport her to the nearest hospital. And I'll tell you, myself and Anna Grace were in the ambulance. My husband was in the car behind us. My other daughter was still at the church being loved on and cared for by our church community. And as we flew down the main road in our town, I realized that traffic was stopping for us. And I think that that was the first moment where I really realized the weight of the journey we were embarking on. I had no idea what was to come, but I remember sitting in that seat, listening to the siren scream when I couldn't, and realizing that the entire world, even strangers, were stopping because of the urgent nature of what we were living. When we arrived at the local hospital, they do have a pediatric ER, and so they were able to work her up as a pediatric patient. However, they didn't have pediatric specialists, so there was only so much that they could do. And unfortunately, after she convulsed yet a third time, no one really knew what they could offer, and so they decided to transport her to the Children's Hospital of Georgia. Now, once we were transported to the Children's Hospital of Georgia, we were there approximately a week. Anna Grace had a multitude of tests done, and we as parents were learning to advocate for her, learning to listen, learning to take notes, and learning how to formulate the proper questions at the proper time so that we could help the doctors understand the scope of what was going on with Anna Grace and what was different about her, but also so that we could understand what our next steps needed to be. Now, we actually did leave the hospital at the end of that admission with a diagnosis, and we've learned along the way that isn't always possible. But we were blessed that after that short 1 week stay, Anna Grace was diagnosed with dysautonomia. And I will tell you that I actually lost my Air Force career to dysautonomia, but it didn't have a name then. And it wasn't something that anybody was ever able to title for me. And so as they described what dysautonomia was, and they explained how it was impacting Anna Grace, knowing my own personal medical history, it kind of made sense. And the pieces fit together. So we were able to leave. We were able to leave the hospital with next steps. We were able to leave with medications to begin, with changes in diet and fluid intake, and follow-up appointments, things that we could do to propel Anna Grace forward on her medical journey. And so that's what we did. We left, we sought out specialists that we were told to seek out, and we pressed on. Now, by the end of March, Anna Grace was in a wheelchair. Now, keep in mind, I said she was an athlete, and she was. That January, she was swimming for her high school, and by the end of March, she was in a wheelchair and unable to walk more than a few steps at a time. And as you can imagine, this was shocking, it was concerning, and it was so incredibly confusing. We were doing the things that we were told. We were seeking the care we were told to seek. But there seemed to be an underlying piece that we just hadn't uncovered, and we had no idea what the future held. Anna Grace, through a very interesting turn of events, ended up in the office of a neurosurgeon at the Children's Hospital of Georgia, and he ran some MRIs and some other tests, and he was able to tell us that Anna Grace had a tethered spinal cord. Now, through these weeks leading up to this, I had actually even gone through her medical records from birth. The benefit of being a military family is every time we moved, I knew it would be important to get those medical records and bring them with us. And so I had them all. And I sat in my office on a rainy day and I flipped through them, and I started with the records from my pregnancy and just went through page by page. And as soon as the doctor in March told us that there was a tethered spinal cord, my mind instantly flashed back to the margin of a page hours into Anna Grace's life. And in the margin, handwritten, was order MRI, tethered cord. I didn't know what that meant. I didn't even know the note was taken 18 years ago. But it was, and because of the circumstances of her birth and because of the car accident and the emergency C-section and the quick note written down that wasn't entered as an order, it was overlooked. And so unfortunately, it took us 14 years to stop that damage where it was at. So on April 9th of 2018, Anna Grace was in an operating room and she was having her spinal cord detethered. And we were blessed. We were so grateful that we had had the experience that we had had up until that point that allowed the doctors to identify this problem and that there was a solution, that there was something that they could do, because not every family is blessed with an outcome like that. And we knew that it was something that was going to involve a long journey, but we also knew that it was just something that could have not had a solution. And so when Anna Grace came out of the OR, she was taken to PICU. And of course, we were right there holding her hand as she woke up and came to. And I can remember sitting on her left side and she was laying flat. She couldn't sit up, obviously. And she asked for some water. And so I let go of her hand and I reached behind me and handed her a glass of water with a straw. And when I let go to grab that glass of water, she said, "Mama, don't let go." And I'll tell you, anybody who has known Anna Grace for any length of time will tell you she is not a cuddle bug. She was not known for wanting hugs or snuggles or really anything that would remotely resemble physical touch. So I really honestly thought that those medications were really doing their job and that she was just hungry for kind of some compassion and some warmth. Little did I know that as those meds wore off and as she became more and more herself again, that we would slowly start to put together that Anna Grace had actually been numb from the neck down her entire life. Now, a lot of people don't understand how we would have not noticed that, and I can understand why. But you have to realize that cold is relative. Soft is relative. And so Anna Grace had memorized blankets are soft. Snow is cold. Cocoa should feel warm. And she could feel it on her face, but she didn't necessarily know that she was feeling anything differently on her hands or the rest of her body. And I like to compare it to being in a snowsuit with mittens. You could feel pressure, you could feel even pain if it punctured through that and went deep into you. But anything at the surface level, you wouldn't necessarily feel. You wouldn't be able to put a pair of mittens on and run them over a bumpy piece of wood and know that it was bumpy. And that is how Anna Grace had experienced the world for 14 years. And so we had to navigate that. We were excited. The medical community that was part of this was excited. It was invigorating to be a part of something so unexpected and so good. It was such a good outcome. It was something to cling to. Actually, the neurosurgeon compared it to living the world in black and white and then experiencing color, like in The Wizard of Oz. And I think that's a great way to look at it. That's exactly what we all got to watch unfold. And it wasn't all beautiful. It wasn't all wonderful. With fuzzy blankets and warm hugs came sharp and pointy and cold and many other, just disconcerting feelings. And so actually Anna Grace's first shower, the occupational therapist had to come and her and I stood in the shower fully clothed with Anna Grace, covered her in towels because the water hitting her skin was just too much. She couldn't take it. And she cried like a newborn baby. But she got through it. She actually ended up showering in socks for the first few months because it just was too much for her skin to feel. And so she pressed on. We helped her navigate the world and navigate these new feelings while also working on neuro rehab and walking again and just all the things that came post-op. She had some vestibular issues, and so we worked through some vestibular therapy. And due to some complications, she actually was in the hospital for a month. But after a month, she was discharged and she got to go home. And she realized she had missed about a semester of high school. So that's kind of the first point of my story. The first thing I want to impress upon you is every patient has a why. They have a reason that they want to get better. They have a thing that they want to experience. They have a life outside of their medical journey. And for Anna Grace at 14 as a freshman in high school, it was to get back to school. It was to finish the semester strong. It was to maintain her grades and her relationships. And so that was behind every question we asked, whether we realized it or not. When we would interact with a doctor and we would ask what our next steps should be or what we were supposed to do, or we would ask what medication could help with a symptom. Really behind that what was a why. And so I think that the best doctors are able to not just hear the questions of what is wrong, what is the diagnosis, what is the dosage, what is the medication, but they're able to look deeper and hear the why I'm asking those questions in the first place. As an advocate and as a mom, I was asking because I wanted to know what the next step should be. I wanted to know how I could help my daughter succeed outside of the walls of a hospital. And I wanted to help her maintain a normal social life and a normal life altogether. I think in a lot of ways that's what we feared the most. And if I'm being honest, probably what we still fear today is losing normal. And I've talked to a lot of parents along our path. I have talked to a lot of patients along our journey. And I really believe that that's something that we all share, is a fear of losing normal. What is our normal? And the doctors who could hear that behind my questions succeeded. And not just the medical community, but her academic community, her teachers, our friends, our neighbors, our family, the ones who would see that the reason we were still going to the doctor and seeking out treatment was because we were looking to help Anna Grace live her best life. Now, she pressed through and finished an entire semester of school in about 3.5 weeks, which was an amazing feat for everyone who rallied with her. And we spent the rest of that summer just helping Anna Grace through PT, OT, some vestibular therapy, trying to still be a part of her summer swim league when she could, and hopefully start the next school year strong. So August rolled around, it was time to go back to school, and Anna Grace seemed strong. She seemed like she was doing well. She was still recovering, but she was doing well. She had learned to manage the symptoms of dysautonomia to some degree and learned the warning signs of the symptoms she couldn't manage. So we felt equipped and we sent her back to school. And it didn't take long before we started to notice that Anna Grace was losing weight. By October, she had lost enough weight that we had begun our GI medical journey, and they had decided to place an NG tube on October 25th of 2018. So Anna Grace had an NG tube and had to adjust to life with that every day in a high school setting. And I have to say that her community did not let us down. Not one kid had one ill word for her. They were all so supportive, and they really gave me faith in our youth today. But Anna Grace navigated life with that NG tube, and in October and November of that year, she actually didn't even have more than probably 800 calories because her body just wasn't processing it. She had some scopes and some procedures scheduled, and in January of 2019, after a diagnosis of gastroparesis and some treatment for some infections, she had a Mickey button placed. That Mickey button has proved to be one of our best tools. And she, to this day, pumps through a little backpack, usually the one that looks like a llama, and it pumps for 22 hours and gives her about 60 milliliters an hour of food. And that has helped her to have everything she needs to continue on, to finish high school, and to be nourished, and to be nourished enough to think, to study, to make memories. That fall of 2018, she doesn't even remember it. She was so malnourished, she couldn't remember it. The blue drained from her eyes, like nothing I've seen before. It was honestly harder than seeing her in ICU. But that Mickey button became a tool, and it took time, and it was definitely a learning curve. And there were plenty of spills and plenty of torn feeding pump bags and plenty of calls because Mickey buttons had been pulled from her stomach and needed replaced. But a tool nonetheless, and one that now has given her more and more opportunities as the days unfold. Now, as she became more nourished, she became more stable, and she had GI appointments, and she had neurology appointments, and she had some other medical issues going on, and we had appointments for those and lots of PT and OT, but she was pressing on and pressing forward, and she really was growing up in the hospital, and she was surrounded by CNAs and PCAs and RNs and doctors and residents and even the schedulers at the front desk. These people became our family. She actually saw them more than she saw her own grandparents. Some weeks she saw them more than she saw her teachers. And so they became her teachers. And you, as a medical professional, as a doctor, or whoever else may be listening to this, you have more than a clinical impact on patients and their families. You impact them no matter what you do. The question is it in a good way or a bad way? Every interaction can have a positive impact or a negative one. And it's a choice, and it has to be intentional. But when you walk in a room and you speak to the parent and you speak to the patient, or you speak to the patient and their spouse, if it's not a PEDS patient, whoever you're speaking with, you're impacting. And the data that you leave, the information that you leave, the compassion that you leave bedside will absolutely impact that patient's health, their emotional health, as well as their relational health with their family. It is hard. It is so hard to balance a child who is ill and a child who isn't, and a marriage and a job, all within the walls of a hospital. And I promise you that every time you meet a patient bedside, the person across the bed from you that is standing there holding that patient's hand often has the weight of two worlds on their shoulders. There wasn't a moment I stood next to Anna Grace's bed where I didn't know that's where I belonged. I knew I was supposed to be there with Anna Grace, but my heart was partially longing to be with my other child, to be with Rachel, to be there for the moments where she sang at the school choir concert, or came home from school excited about a grade, or needed a little encouragement to get a project done. But I can't be in both places. And I'm blessed. I have a community that rallied around me in every way. And I have a husband that multiplied my efforts and was always present for all three of us. And we did our best. But there's lasting implications of this. And it did affect Rachel. It did affect Anna Grace. It did affect my marriage. It did affect my husband. And when doctors, when medical professionals forget that that's a piece, unfortunately, you leave behind questions, concerns, or just anxiety, fear that then erodes at those relationships. And so every time you interact with a patient, especially when they're chronically ill or they're going through maybe the diagnostic process, know that whoever is on the other side of that bed is trying so hard to advocate for that person, but at the same time, trying to hold together relationships that may be hurting and that patient may need to have intact when they leave the walls of the hospital. And so that's just something that I really wanted to share with you and be a little bit transparent about, because I think it's easy to lose sight of. And I think that there are countless families that suffer because they don't have a medical community that is willing to invest more than data into their circumstance. Now, we pressed on from this point in Anna Grace's story, and she continued to excel at school. She continued to learn from her physicians, and I continued to advocate for her to have every tool possible to hopefully be the healthiest version of herself that she could be. And we really worked together to equip her to pursue her life. And as her senior year became present and she began to start to navigate that, we started to have conversations about college and about careers and about prom and about walking across stage. But unfortunately, Anna Grace's legs were not getting better, and they certainly weren't staying even where they were. They were deteriorating. And we kind of began to realize that we needed to just look a little further. And so Anna Grace actually just had a nerve and muscle biopsy at the beginning of August. And we're working on investigating those findings to see if we can figure out what's going on. But she has been fitted for her own wheelchair, and she's in that about 80% of the time now. We don't know if Anna Grace will need that forever or just for a part of her life, but we do know she needs it now. And so we're helping her to figure out how to balance what her hopes and dreams and desires are, while also making sure that whatever she pursues, whatever she chooses to invest in, is a life that she will have the opportunity to live. And, when they're little, you look at your children and you think, gosh, they could be anything, right? They could be president of the United States. They could work for Elon Musk and go to the moon. They could do anything. But it's not really true. And as harsh as that sounds, we can't be anything we want to be. None of us can. I have a severe peanut allergy. I will never be a peanut farmer. That would be ridiculous. Why would that be something that I would pursue? And so with that same kind of thought, we have to help Anna Grace wisely choose what her next step should be and what it is that she wants to pursue. And that is why she's chosen counseling and psychology, because she knows she has a story. She knows she has an experience, and she knows she can bring that to a point of care for patients and help them to navigate their own medical journeys, and hopefully help families much like ours stay strong and stay equipped and help them navigate their own journeys. And to know that she's trying to do that is something that blesses my heart. It helps me to know that despite it all, it can be used for good. And that's exactly what she's doing. Her journey isn't over. She is not, by any stretch of the imagination, what I would consider healthy, but she is equipped and capable, despite her disabilities, despite the many functions of her body that just fail to function. She has doctors, nurses, staff, a family that is rooting her on and equipping her to move forward. And she is now 18. So she is starting to have to navigate for herself. And that's a transition. And it's something that I'm very passionate about. Whether it's at this side of things where you have a child transitioning to adult care, or even at the other side of things where you have an adult transitioning to care that needs to be managed by an adult child or a spouse because they're now unable to do it for themselves. That transition in care, it leaves open many doors of opportunity for miscommunication, for unfounded fear that just really isn't necessary. And it leaves the door open for families and relationships to be damaged. And so I really believe that as a medical community, it's important for us to rally around not just the patient, but the patient's support system, and make sure that everyone in this support system is equipped to help that patient transition on either end of the spectrum. Now, for Anna Grace, she has a multitude of specialists. She has some incontinence issues, and she has had to have a neurostem placed that was actually taken out in November of 2020 in an emergency surgery that, just had to happen because of some infection. But she has a lot of specialists and a lot of care. And so what I have chosen to do with her is the first thing that I had her manage was her mental health. One, because by choosing to do that first, I was inadvertently sending the message that it was the number one priority. Because any patient that doesn't address their emotional well-being is likely going to find that medications and other treatments or even just procedures are going to be less productive. They're going to be less helpful. And so it really was important for me for Anna to learn that not only is that a priority, but I wanted her to have the skills to navigate that piece of her care first and foremost. And so she began by making those appointments for herself and communicating with those doctors herself and making sure that she had that piece under control. And I was there to answer questions and to help guide, but it required physicians that were willing to be just a little more patient, answer that one extra email that maybe she had to send because she didn't understand the proper process. But because of their patience, because of their compassion, she now is fully capable of managing that piece of her own care. And so we transitioned then to lab appointments and to medications and mixing formula and replacing her Mickey button herself, because Anna Grace now has a service dog, and I'll tell you, he's a blessing and he's wonderful, but he's a dog and he has 4 limbs and a tail, all of which can get caught on a feeding tube very easily. And when it gets caught and you put all the energy of a 9-month-old service dog wrapped up in that feeding tube, sometimes it just gets pulled out. And so now that she is up in North Georgia, she needs to be able to replace that herself and save herself the visit to the ER. And she has learned how to do that. And her GI doctor has equipped her and equipped me to help her to learn that. She also now is managing some of her specialty appointments. Now, the things that are a little more complicated or maybe surgical or maybe still in a diagnostic process, those aren't things that she's doing alone. I don't think any of us would do those alone. But she's able to have ownership of her care. And I think that that's something, again, no matter where you are on the spectrum, whether you're at the beginning of life and you're a young person and your parent is still in control of your decisions, a doctor coming into the room and speaking not just to the mom or the dad, but speaking to the child and helping them understand that they're not being talked about, they're being talked to. they're being equipped and they're being given the tools that they need. And then as they hit kind of these later childhood years where Anna Grace is, that moms and dads and advocates are rest assured that the doctors have the child's best interest at heart and that you will help them navigate through those choices, and you will help them know what questions that maybe they haven't asked. One of my favorite questions, and one of the things that I have instilled hopefully in Anna Grace and Rachel, is when you're done having a conversation and it's overwhelming and you don't know the medical terms and you don't know what even to ask sometimes. A lot of times when a doctor comes in the room and they give you data and they give you information, the question you have 2 hours later is the question you wished you had in that moment. And that has happened to me countless times. And so what I have learned is to teach the girls and myself to ask, is there anything I'm not asking you that other people usually do? And I find that I usually get an answer. Usually there's something that a bunch of other people think to ask that I don't. And so it pops into their mind and they're able to share that piece with me. But how amazing would it be if the doctor asked the same thing? If the medical professional sitting across the bed from me said, is there anything that I'm not telling you that you feel like you need to know? Or is there anything that you're concerned or fearful of? And then wait and listen for the answer. When a doctor will come in and speak directly to me, a lot of times the way that I will gently guide the conversation back to Anna Grace and her being asked the questions is I will look at her and I will say, Anna Grace, do you have any concerns or fears? Because to a child, they're very different. You can be afraid of the dark. You can be afraid of a thunderstorm. You can be afraid of the needles or the MRI machine or the CT machine, but you can be concerned you're not going to get to go to prom outside of a wheelchair. You can be concerned that if you start losing weight again, you're going to have to get an NG tube. And those can turn into fears very quickly, especially with a child. And I think that if we ask these questions, we can sometimes help our patients that we are advocating for, or that we're helping, or that we're part of a community with, and we can help them understand that some of their fears are unwarranted and not a concern at all. But if we don't bother to ask, we won't know. So Anna Grace, hopefully, is equipped to ask these very questions. And I know that the medical community that is surrounding her absolutely are physicians that are going to ask these questions. The physicians that won't ask these questions, the physicians that won't hear concerns, the physicians who write off fears, these are physicians we don't see twice. These are the physicians that we don't recommend when I get a random phone call or a random text message from a mom I've never met who heard my name and was told to reach out to me because my daughter has a similar story, or just they need some support. The physicians that come in, deliver data, and leave. Don't be that doctor. Don't just give data. I know you're a scientist, and that's amazing, but you have to be deeper. You have to be willing to connect, and you have to be willing to understand that just like under your lab coat, there's a heart that's beating for something, a heart that loves and is passionate about something or someone. Your patient has a heart under that hospital gown that longs to be somewhere else. And so know what it is. Know what it is that they're trying to get home to. Because if you help them know how to get there, believe it or not, I think that the medicine that you apply to their situation will actually be more effective. Now, we have a story that led to hugs and warmth and lots of surgeries, many of which were in the middle of a pandemic, which I don't recommend. We have two miracles of daughters. I mean, they're just blessings that I don't have words for. But we also have a community, and that community is medically trained. They're clinical, but they care. And by being doctors, by studying medicine, by practicing medicine, you're becoming part of my community, and I'm becoming part of yours. And I hope that as you continue on with your studies and as you continue on with your career and you find yourself bedside and you see the patient and you listen to their concerns and their fears, that you'll look up across the bed at the concerned eyes that are standing bedside with you and not see a difficult parent, not see questions you don't want to answer, but instead see an ally who wants nothing more than to take the information that you have studied years to obtain and take that and use it as a tool to help the patient between you live a fulfilled life and the happiest life that they possibly can live. If we could figure out a way to bridge that gap with the very heart of the patient between us, I think that we would find that all of our patients and all of our families would be stronger and healthier physically and emotionally. I'm so incredibly grateful and excited to be a part of this amazing event that you guys are doing. And I know that a lot of wonderful thoughts and wonderful ideas and brainstorming comes from this. And I just applaud you. I applaud you for taking those steps. And I applaud you for already being willing to go a step further and to not just provide care, but provide care to the heart of the matter, which is the patient and the things that they hold dear. Thank you so much for listening to me. Thank you so much for your time today. And I just really do wish you the best of luck with this competition. And I am incredibly humbled to have had the opportunity to share just a little bit of insight from the other side of a patient's bed. Thank you so much and have a wonderful day.